Today we are recording video of the muscle-fascial chains. This is a very good opportunity for those studying muscle testing, to learn muscles, learn circuits and learn to understand work easily and simply. Before you is my student Adil. I have never tested it for musculo-fascial chain disorders, so this will be an excellent demonstrative video. Our task is to find out the following. We have several muscle-fascial chains, superficial ventral, superficial dorsal, which is located from the back. There are two lateral chains, a spiral chain and a deep ventral chain. All these chains collect the body. Two lateral chains are fixed in position in the sagittal plane so that the body is fixed against falling to the sides. The ventral and dorsal chains are the sagittal plane so that the person does not fall forward or backward. And there is a deep ventral chain. It kind of collects the body inward and it is, let's say, a chain of interaction with all other chains. And we have a spiral chain that twists the body in a horizontal plane. So, to test, you need to find. The first is the chain indicator. It's a muscle at one end, well, let's just say the torso. You will need a muscle that closes the chain. This is a muscle located distal from the first muscle, that is, at the other end of the chain. What violations can be found in the chain? In principle, you can find a ligamentous disorder, you can find muscle. In addition to all this, there are other things that can be kind of a problem in the chain. These are muscle turn-on sequences. This is more of a neurological disorder. This may be a muscle disorder of its own. But now our task is to analyze this case on camera so that I can tell you all this. We'll start with the superficial ventral chain. The muscles included in the chain are the extensors of the fingers, which perform extension, dorsal extension. These are the tibialis anterior muscle, the rectus femoris muscle, the rectus abdominis muscle, the sternum fascia, the sternocleidomastoid muscle. These are the main muscles we test in this chain. Let's start with the tibialis anterior muscle. It is tested as follows. The leg is lying. The hand grasps and fixes the leg so that the leg does not rotate like this. If the leg starts to rotate in this way, this is already a wrong test. Next, we extend the fingers and rotate the foot inward. And we ask the client, in this case my student, to press this part with his thumb towards the knee joint. In this case, we will see the tendon of the tibialis anterior muscle, which means it has turned on. Test. The muscle is strong. We look at relaxation. Yes. Can relax is a good muscle. I can take it as an indication. I'll check the circuit. We must raise him. He raised his head. Hold it. Yes. No. All this is normal, it does not turn off. By the way, I will say right away that in one of my videos published earlier, I said that chains are normatonic and hypertonic, and of course, in this case, we see the chain in a fairly good tone. But we do not know how normal it is. In order to check for the norm, it is sufficient to include some muscle in the middle of the chain, between the two extreme muscles. If the chain is relaxed, this is the norm. If the chain does not relax, then it is hypertonic. She does not know how to relax. Her defense mechanisms are violated. Therefore, unfold. The sternocleidomastoid muscle was included. Well, let's say knocked on the rectus abdominis muscle. Press. The chain did not loosen. You can do the following to contract the muscle artificially. Lie down. In this case, when we artificially contract a muscle, the circuit is turned off. This is a normal reaction, and it should be so. This means that this chain is normatonic. This is the relaxation reflex that all kinesiologists use in any muscle. This shows the body that the muscle is contracted through the neuromuscular spindle. It is not necessary to strain your abs. We also take the tibial muscle from the opposite side. Press like this. Everything. Dene muscle became hypertonic. This suggests that this circuit is in violation. What is the violation? If the initial chain indicator, normatonic, became hypertonic when the distal part of the chain is turned on, this indicates a muscle disorder in the chain itself. Press. Press. The muscle chain disorder is concentrated in the rectus femoris. How did I know this? I turned on the circuit, saw its dysfunction. Looked at the muscles with pinch provocations. These are classic tests for detecting circuit dysfunction. And I saw that when I do the provocation of the chain along the rectus femoris muscle, the initially hypertonic muscle becomes normal. I found a muscle that is dysfunctional, and this circuit does not work well because this muscle does not work well. See how it looks in real life. Up. Initially, the muscle is strong, turned the head, raised it, the muscle was weakened. As soon as the neck turns on, the leg stops working. So we figured out that we have muscle dysfunction in the chain. Now, does it make sense to treat this chain in the context of working with muscle-fascial chains? Subscribe to my channel, and then we will sort it out with you.